discussing about the age of the patient when patients have their surgery. The youngest patient that I've ever operated for gallstone disease was a 13-year-old young girl on whom I operated in 1995 in Somerset in England. And her gallbladder was full of stones. There must have been more than 60 or 70 small cherry-like stones in there, which we removed. The oldest patient that I've operated was in the 90s. So there's a wide variation of age group. As far as the asymptomatic gallstones are concerned, a good body of surgeons agreed that if back in 90s, that's the last millennium, that if somebody was around the age of 60 or 65 and was found to have gallstones, then we could go gentle on this and consider leaving it alone, wait and watch, and if they had any problem, then to consider surgery. But generally, the younger patients have a long way to go, and they are likely to have problems, which are namely biliary colic, pain, infection, blockage of the gallbladder with abscess formation or empyema, perforation of the gallbladder into the peritoneal cavity or into one of the visceras. And these are all the complications when the stones are within the gallbladder. But there are some other complications which can occur if one or more of the stones slip out of the gallbladder and enter into the common bile duct. And commonly there are three complications which can occur, either severe infection or cholangitis, which makes a person shake, shiver, and feel very unwell. And the other complications are jaundice and finally the pancreatitis. As far as the infection and jaundice are concerned, they are easily treatable and one does not need to feel alarmed about it. But pancreatitis can be a serious complication of the gallstones and causes inflammation of the pancreas gland, which deals with our diabetes as well as with our digestion of the food in our body. And if it gets inflamed, in majority of the cases, this will settle on its own within a day or so without any consequences, and everything will be fine, and one can have one surgery afterwards or during the same admission, which is the ideal way of treating it. However, in a very small percentage of patients, the pancreatitis can be severe. And a severe pancreatitis can carry a mortality more than 80%. And one is very likely to die from that. But even if one didn't die, the admission in the hospital can last for months and may require several surgeries and operations to deal with the complications of the pancreatitis. Those surgeons who deal with pancreatitis on a regular basis or who know what can go wrong and how badly this can go wrong, they are probably in a better position to advise their patients about all the risks and complications. So it's best not to take gallstone disease very lightly. At my age, if I was found to have stones in my gallbladder on an ultrasound that was done for some other reason, they have a meaning that I'll fit into the classification of incidental gallstones, I will opt for surgery and I will not delay it, knowing that what are the possible things that could go wrong. Though I must declare here that every time there are gallstones, things don't have to go wrong, and people may live with their stones for years without having any problems whatsoever from the gallstones. However, these should be taken seriously, and appropriate discussion with a suitably qualified surgeon should be done, and it should be treated accordingly.